Hello, everybody, and Yusuf, welcome. Um, my name is Daqa, and today is actually our very first webinar for Give, Mind, Grow, which is the little baby under Give to Learn to Grow. We originally, as you know, focus on education, but Give, Mind, Grow is really all about giving education to the Somali community, all about mental health and addiction, especially how can we eradicate the stigma and the cultural barriers so we can be well equipped. Every single person that I've been speaking to about this project tells me like they're struggling, they have a family member, everybody knows somebody. And because it's a culture of silence, nobody's talking about it. But Lakin, today I am so honored to welcome Yusuf. Yusuf, before I go into all of your details, please tell us a little bit about you.
Yeah, sure. Hi. I don't know if it's good morning or afternoon for y'all, but it's kind of afternoon here in Minnesota. But my name is Yusuf Shafi. I'm trained as a mental health practitioner and also a licensed alcohol drug counselor. So I, wanted to do this because there's addiction and mental health is something that is big in our community. However, we don't talk about it much. So I wanted just to sort of create a space for people to come in and get some help. There's a lot of issues in our community, and so I thought when I was young, I said I'm gonna go to school and do something about this. So I'm happy to be here. I want to learn from you guys as well. So excited to be here, and I like your accent there.
Thank you so much. Yusuf has also been modest. Yusuf also has the first treatment center for Somalis by Somalis. And when I say treatment center, a rehab facility. So please tell us a little bit about the rehab facility and why you started it.
Sure. So when I was in grad school, I worked in the community clinic, and I've seen a lot of people struggling with alcohol use disorder at the time. And they were literally, we didn't have a treatment center for our people, and I thought this is not right, And so I said after grad school, I decided to open Alliance Oneness back in 2015, and so it's a center that is dedicated to helping folks that are struggling with addiction and mental health. We have grown. We have over 36 beds right now, and so.
What does 36 beds right now mean?
So it means that we have capacity where people can stay in our housing, and we have inpatient with a 24-hour staff, 24-hour care, basically, with 36 clients. So we can serve up to 36 clients, only for males at the time, but we're maybe working on the women, the girls are struggling as well. And there's only so much we could do. So we have only men right now, but we're working on adding the women's program as well.
Inshallah, someday soon. Why mental health and addiction? Like, what was your motivation?
Well, for one, I've seen, in our community, we had this guy who was, alcoholic, who was our neighbor. The cops would get called all the time, and people would come in and just, talk about it and then just kind of move on. Like nobody would. It was like the big elephant in the living room, but nobody said anything about it. So I was like, I'm gonna figure out what's going on with this guy when I grow up, and that's why I went to grad school. I went to undergrad and grad school and studied addiction and mental health, and sort of my job is to make sure that we end stigma. That's actually our goal. One of the things that we try to do is, addiction is like any other disease. So it's sort of doing a lot of education in the community, giving back, and supporting others. And saying, this is like if you struggle with diabetes or whatever, you would go talk to the doctor. You wouldn't send your kid back to Somalia for Dr. Alice.
You would we're going to talk about that and how common that is.
Well, yeah, I have my opinions about that. And so, you wouldn't send them, you would send them to a doctor, not back home. So I wanted to create a space for them to come in.
And so when we talk about addiction in our culture, for example, we're not supposed to drink or do any drugs in the first place. So we're not talking about people who casually dabble. What does addiction actually mean, and reference it to the Somali community?
Well, First of all, addiction is a disease. You know that there's a lot of proof and facts. There's research that's done on this that addiction is a disease. Um, for our people, I think there's a lot of there's a lot of shame associated with addiction. So let's say someone is struggling with alcohol use disorder or opioid use disorder. A lot of our young boys, young girls are struggling with opioid use disorder. This person cannot work or go to school. This person, is always getting into a fight with their family. Sometimes they make a lot of bad decisions, like drinking and driving, or doing under or stealing from their mom or their dad. That's how you know when someone is addicted. But yet there are people that actually don't want to believe it. I mean, it's the truth, but I think a lot of our community sometimes they have a hard time believing that. Like, how is my son addicted? So the mother might hide that son on her daughter and keep him at home, and not. But the thing about addiction is you can't hide it; it always comes out. You know, it is unfortunate, but
It's not a solution as well. They don't get better.
they don't get better. They don't get the help they need. There's a lot of shame. There's a lot of I mean, our culture is built around shame. Everything is an ebb. We don't talk about sex. We don't talk about mental health. We don't talk about, if someone even dies of cancer, they're like, عذرك خوفي كل انت, like, we don't hush hush, like,
That's the hush hush,
yeah,
yeah.
everything is like, well, unfortunately, that's not how things are changing. These kids, things have changed. I call them kids, but they're 20-year-olds, 20, 25
Yeah.
year olds. And a lot of them, it's hard for them. They're trying to fit in and be in the Western culture, but Hoya and Abu still want them to be Somali, and so there's a huge conflict. And a lot of these kids are struggling with a lot of mental health. That's why they use the alcohol and drugs to deal with whatever they got going on.
Yeah, no, we'll definitely get into that. Can you give me a little bit of like an overview of your a typical client
Sure.
for you who is in your facility?
Absolutely. So the first thing is the person would have to call in. First step is the person who's getting help must be willing to get some help, right? So oftentimes we
So
get
Ahoya can't drag him to the
no,
place. They
no,
have to
you can
say, I need help. I have a problem.
exactly. And then we run into that problem a lot where Hoya wants him to get help or Abo, but the kid is like, no, I'm not doing this. I don't want to get help. I don't want to be in rehab, which is understandable. I get it. But so the first step is the person has to need the help, and they have to accept that they need help. So we will do something called a screening form, seeing if they might be a good fit for our program. Um, so we do the screening form, ask a lot of questions like, how much are they using, how long, all that kind of stuff. What kind of substance are they using? Alcohol, marijuana, opiates, khat, a lot of different drugs, meth. There's different kind of drugs, cocaine. So after that, then we will schedule them an assessment, something called a Rule 25 assessment, which is sort of like a diagnostic assessment or a chemical health assessment. So they meet with the counselor for like an hour and they ask him a lot of questions. Where do they live? What do they do for a living? How long they've been here? Um, the, what environment are they in? Have they relapsed? Have they been sober before? That kind of thing. Do they have a job?
Yeah.
Do they go to school? Do they have a structure? All those things are questions that we would ask. And then after that, we would make a determination if that person is outpatient or inpatient. Um, and then after that, let's say if they go to the inpatient, um, we would do another intake. There's expectations and rules they have to follow. Like, for example, the first 2 weeks there's no cell phone. If they're taking meds, they have to be compliant with their medication, and they have to have visitors certain time. So in the morning, basically, what rehab teaches people is structure, right? So
Structure
when
and
people are
discipline.
struggling with addiction, it's really important for them to have structure, right? Uh,
Yeah.
and so in the morning when they wake up at 7 a.m. So for a typical day is they wake up at 7 a.m. Um, Monday to Thursday. Uh, they come into to the group. We do group therapy from 9 to 3. They get breaks, of course, lunch break and stuff. And then after that, in the morning before they leave the
And then
house,
they go,
they have to make their bed. So that's one of the things. Like, again, small things, making sure they
small things,
do
discipline.
discipline, making beds, making sure the house is clean. So they get to the house 3 o'clock. They get done with the rehab, and then they can go play basketball or work out or whatever. And then they have dinner at around 5, 6, and then they could be on play video games or whatever, and then do their chores.
I have a question. So my question is, say there's two people, okay, and one can casually drink, and the other one like become say, what makes somebody an alcoholic more so than the other person, and especially in Somali community, what do you think is behind, you know, the reason why we need this medication to? What do you think is mainly the reason behind it?
Okay, so I think one of the most important thing is, like I said before, a lot of people, what I've seen for a lot of 90% of my clients are duly diagnosed, meaning they have not only substance use disorder, but they also have some sort of an undiagnosed mental health issue, or maybe even diagnosed
What
mental health.
we, yeah.
Exactly. So let's say I'll give you a perfect example. I might have someone who is uh 31-year-old Somali man. Uh, he's been struggling with addiction for 10 years, let's say, since he was 20, since, the last 10 years he's been doing drugs, struggling with addiction, going to jail, out of rehab, in and out of rehabs. He's 31. All his friends got married. Everybody got married. They all have kids. Now, like, there's a lot of self-confidence issues, right? Because all my friends are getting married. Here I am. I didn't even finish college. I didn't go to school, but my best friend is getting married that I grew up with. And Somali people, we're really good at comparing. جامعات
We're so, yes,
yeah, yeah, yeah,
absolutely.
yeah. هذه ماشية إيه for that. So that puts a lot of pressure on the person. Well, guess what? They want to go drink more or use opiates or whatever substance they're using, so that way they don't think about their friend getting married, or and or maybe they have self-confidence issues. So that's what the problem is. I think it's really important for us to talk to our kids and not to compare to other people.
So you said mental health and addiction are very much correlated.
Yes, yes, they are.
And obviously somebody's suffering with depression or anxiety, whatever the case might be, and so they use alcohol as a medicine. Before we even get to the addiction, how can we prevent it as a parent, for example, who has an 8-year-old or?
Sure, that's a good question. So the first thing is, as a community, I don't think we do a good job with prevention, first of all. So thank you for the important work you guys are doing. I think the most important thing is, it might be silly, but you gotta be friends with your kids, right? For our community, like
Somali parent being friends with their kid?
you got to be, bro. You have to
Huh?
be. You have to be friends with your kids, because your kids will tell you. They will tell you that if you're like, oh yeah, I'm struggling with this, or Abu, I'm struggling with this. They will tell you if you're like they can't abstain. If they're afraid of you, then it becomes a problem. And we have to
Yeah.
talk to our kids as
And if
Somali
they're afraid
community.
of you, they won't talk to you about their
No,
problems or what's going on in school. Nothing.
exactly. So it's really important for us to make sure that we're friends with our kids, and we also have to talk to our kids, right? I have a 1-year-old son. I talk to him all the time, and my family or some friends might be like, "Well, why are you talking? He can't even understand you." I'm like, "Yeah, but it's really important to socialize with your kid and to read to them and this and kind of things like that." So I think it's really important for us to make sure that we talk to our kids, and we have to be friends with our kids. I think that's how we could start.
I also want to go back to, my experience is always like, make sure that they have clothes and food and
Oh, yeah.
The outside is taken care of.
Yes.
But do we need to teach them that they, like you said, be friends with your kids, talk about who their friends are in school and so forth. But that's not really part of our culture. We just tell our kids to do
No,
things.
it's not. And the interesting thing is, like, a lot of the kids, I call them kids, but again, they're between 18 and 25.
Yeah.
I think it's important. What I've seen a lot for the clients that we serve, a lot of them just need love, right? LOVE. That's the secret sauce, because a lot of these kids are sometimes, mom and dad might be working two jobs, and which is, I understand. We live in the west. In the west, we have to send money back home. Oh yeah, I'm
Hmm.
working for them. So I think it's important for the parents to understand that our kids needs time. You have to be spending time with your kids. Now, there might be a debate about having, when you have 9, 10 kids, you only have 24 hours a day. But again, maybe that's what Adam people do. They have 2 or 3 kids because they know that they can't really, be there for every kid. So spending time with your kids, being friends with your kids, being there for them, their first, basketball game, baseball game, whatever, soccer, being there for just being available. This whole
So
idea of I'm gonna buy you some brand new Michael Jordan shoes and this, those things are all material things. The kids, the memories you have to create. You have to travel with your kids. You have to, you cannot just work 7 days a week, be in 5 different ayuto. You need to be there for your kids. You need to spend time with them. I think that's important.
can we, and some might say this to me, but can we talk a little bit more about love, as you said, and words of affirmation, and like
Oh yeah.
how important it is, because it is completely not our culture. And so, like, as a parent, how would you encourage a parent to, give more words of affirmation when our culture is like, what do you saw all of that stuff?
I know. No, I think those things are important. I mean, I look at my life, and so my mom, for example, I love her. She's amazing. I don't. Other people tell me like, we're so proud of you. You're doing good work, whatever, so forth. Uh, my Adan friends, even my Adan's friends, like I grew up with, their parents will text me and say, I'm proud of you, good job, whatever.
Yeah.
Um, Hoya will brag to other women about me, like when I'm not there. But
That is
then,
so true.
yeah, when I'm there, she never says anything. I'm like, oh, this is really interesting. But that's
That
our
is
culture,
so
right?
true.
That's our culture. So there's this sense of like, Ilmaha, I love you, Hoya, I love you, I'm proud of you. Uh, just being friends with your kids, talking to them. How was school today? Who's bullying you? Is someone giving you a hard time? These kids are black at the end of the day. They're Muslim. We look different. We have different culture, and especially in this time, it's really important to have conversation with our kids. Like, who's giving you a hard time in your class? Even ma'alamin, some of them, you have to be on top of your kids and making sure that they're learning what they're supposed to. Because sometimes we don't do it in our community. I think that's where a lot of the problems kind of stem from.
Okay, so can you talk about some of the solutions that our culture uses that doesn't work at all? Like, for example, you said Daqan Alis, right?
Mhm.
So, like, we've all heard of, your so and so cousin at 16 years old was getting into trouble, school, whatever the case. And the parent's solution was Somalia and Udarena. We'll send them to Somalia. That's how. But most of the times they come back, and sometimes they're even worse
Yeah,
because it's like a band aid.
that is a fact, and I've seen that. Honestly speaking, I've seen people um, that were struggling, and they, which is, I think Dakan Alice is not bad in a sense. Sometimes it's not all bad. There are people that go there that do well, and so I want to just kind of clarify on that. But there's some of these like boot camps or where they keep kids and they actually abuse kids, physically, mentally, sexually, and some of those kids come back with a lot of anger, a lot of resentment towards the parent, and a lot of these parents don't communicate with these kids. They will just send them, oh, vacation, I didn't know, and then they will leave the kid there. Now you're abandoning your son or your daughter in the house, um, and leave them there with nobody to protect them in a sense. So those kids get abused mentally, physically, and sexually. And I've personally have had clients that when they come back, they don't want to see their mom or dad, and then they go back to using alcohol and drugs because now they have more trauma.
They need
And
to numb the pain.
exactly.
Wow, that's a lot. I can
It is.
only
It
imagine.
really, it really is. It really is a lot. It really is a lot.
Say you have say somebody within your family, your immediate family, is addicted to drugs or alcohol. How can you help them without enabling them? So,
Yeah, that's a good question. So I think with anybody, you have to set boundaries, right? So I've had Mamoon that will come to our office all the time, and they go, and I understand they're struggling. This is your house. You pay rent. You have a 19-year-old. There have to be expectation and rules in your house. So, for example, curfew is midnight or 11 o'clock or whatever. That's boy, or girl has to come home at this time. You know, if not, you have to set boundaries with because the kids are very smart. They know what they can get away with, what they can get away with, and it all depends on your family structure and your family dynamics and all that. But I think it's good to love and to also set boundaries with these kids and know how this is what I can do for you, and this is what I can do for you. You know, or Abba, so let them know the kids and you're there for them, but at the same time, if they don't want to get help, I guess you really can't help somebody if they don't want to help themselves.
You have to be tough with them, yeah.
Yeah, yeah, and you also have to show love and say, one day they probably change their mind. Oftentimes, when people are under the influence, they get into trouble with the law. They get locked up or they go to jail. Now they're court ordered. Now they have to do it. So sometimes that happens. My Monica will pray and say, Allah yo mali khiro. Allah yo, let him go to jail, which is pretty sad. But that's what happens a lot because you can't 25-year-old, Mama Duka, she cannot just bring him here. That's not how it works. And the way the law is set up is the person might have to commit a crime or do something bad, then they go in the system, and then they come to us. Which is pretty sad.
I have somebody here commenting that said trauma is the biggest elephant in the Somali community. Or, can you speak a little bit about that? Some of the traumas, and how we can, help our children or prevent it before it escalates.
Absolutely. I mean, so it's actually a pretty interesting question. Trauma is something that is different for everyone. And even for like, I think about my mom's trauma, and I think about my trauma, and I think about my clients who are 18-year-olds trauma. Is completely different, 3 different generations, completely different traumas. So my mom went through the Civil War, all that stuff, or my parents did, or people that are older went through the Civil War. And then you have me who came to the U.S. There's not a lot of Somalis at the time, discrimination, language barrier. I had my own trauma from that experience. And then you have kids that are like 19-year-old, 18-year-old that have trauma of like gun violence and opiate overdose. Maybe they saw their friend, literally some of them, their friend overdose next to them, right? So they have guilt. There's a lot of guilt of like, why am I alive and why is my friend not here? Does that make sense? And so living with that every day is hard for these kids. And these kids there's a huge disconnect between them and the family. And the family don't understand trauma or depression or anxiety. You tell my mom, I have depression. What order literally, and I quote unquote, go pray. It's like they don't even understand the word trauma, but they do have trauma. And I think people have to learn how to heal, and I think that's the biggest part in our community. Everything is, oh, I'm fine, you're smiling, but deep down you're hurting. And we have to be honest with ourselves. If we're not honest with ourselves, we cannot help, because those trauma, tomorrow you're going to get a husband or a wife, and then you're going to bring that trauma to your family too. So as a community, I believe in seeing therapy, medication, whatever works for everybody's different. So whatever works for you, I think I would do that.
And a little bit of a history. So I have another question here from Asab, I believe. It says, has addiction always been prominent in the Somali community, or is it different in the diaspora compared to like the Civil War, or before the Civil War, Somalia?
That's a good question. I don't know. It's interesting. Our referral have changed. So Alliance was established back in 2015 when I opened. In the first 2 years, it was all like alcohol, marijuana was the primary drug of choice. In the last year and a half, 2 years, all 19, 20, 21, 22, opioid use disorder. So alcohol and drugs have always been there for our community, but now that it's part of the Western culture. I don't know about Canada, but in the US, with coronavirus, it's been hard. People have been using drugs at a higher rate.
To cope, yeah, absolutely.
People are depressed, people lost their jobs, a lot of different things have happened. So people have to be in quarantine. So it is a different time in a sense. So
my question is, obviously there's a huge stigma around alcohol, but not so much around pills. So do you think, or opioids or whatever the case might be, so do you think it's, we don't necessarily understand the dangers as much? And talk to me a little bit about that trend of the opioids and overdoses in the US.
Yeah, I think these kids all there is actually more stigma using pills. Like even the clients themselves, when they're in group therapy, the ones that use maybe marijuana, but I'm just smoking marijuana. It's not a big deal. They kind of minimize it versus if someone struggling with like meth. So there's also discrimination in the recovery community about, oh, you're doing meth, or I'm just smoking weed, or oh, I'm only drinking alcohol, but you are doing pills. So there's also disconnect in the recovery community about in this discrimination within clients.
Of course, like some,
yeah. So I'm just drinking, man. I don't have any problems. but here you are taking pills. So it's like there's a lot of discrimination within the clients as well.
Oh wow, that's I've recently seen that there's been quite a bit of overdoses in the U.S., also here in Canada. Um, it's tell me a little bit about that in the Somali community.
Say that again. You just kind of
Death overdoses.
yes.
People dying of I'm not quite sure what the intake is or how it's taken and so forth, but yeah, like for example, how to stay safe and maybe not go down that road.
Yeah. I actually we have had a lot of deaths. I don't have the exact number. We don't know the exact number. They doing some research, so we would know. And I think the biggest challenge for a lot of folks and a lot of families too is when someone dies, like a 20-year-old, 20, there's a lot of shame with that too. So a lot of the parents, a lot of families might say, "Oh, so and so died of a heart attack," or "So and so they died in their sleep." So sort of even
But
hiding.
really, they died of a drug
Yeah.
overdose.
Yes. And so it's pretty sad. I can't even imagine what the parents are going through and the family, but it's hard for them to be honest at times. And I get it. There's a lot of shame associated with that. In fact, we have a Mama Howell. Maybe we can invite her. She's amazing. Her son died of overdose, and so she came out as a pioneer in our community and said, "Yes, my son overdosed. This is what happened." And in fact, you can find her. I could send you her YouTube video. We did an interview with her, and so she was like, "I want other moms to or other parents not to go through what I went through." And so she's talking to parents, and I can connect you with her. Maybe we can invite her one of these days. And
Yeah.
she's
So
amazing.
she's a mom and she's come
Mhm,
forward and she's
mhm.
advocating.
Yeah, she is. She is.
Wow,
Yeah.
that's amazing.
Yes. Yes.
And so what advice finally it's what is the first steps as a parent or even as somebody like how should we talk about this more? How can we help the people around us or our children or how can we do more?
Yeah, I think we just have to be educated about this issue. So doing things like this, talking to our kids, being friends with our kids, being open and being honest in the family. Like every family has a different dynamic. There's a different family culture. Everything doesn't have to be just be upfront with their kids. Be honest with their kids. Talk to them about this issue.
Everything is
Yep. So that needs to stop. That needs to go away. Like if
no more
no more. If someone, we need to break the silence. Someone said that. Thank you, Ahmed. We need the moms, especially the parents, the moms especially. Like you don't. A lot of our people do care about magahan, and all that stuff needs to go away because kids are dying left and right, and it breaks my heart, And we need to do better. And actually, more people will come up front at a younger age or ask for help, but then. Okay, while see forget we don't welcome them. We just say, okay, oh, enable kid, oh, Cassie is struggling with this, yet their own kid is struggling, but then they don't want to come up, and talk about it. So I think that needs to end, and just being honest. I think Somali like wax kasta put on everything while so that needs to go away. And I think if we do that and have more centers available like ours to people, I think we can give more people help and prevent that and kind of tackle that issue before it gets too late.
So great. How do we help the older mums? And what I mean by the older mums, like, somebody, a 60-year-old mom and so forth, like, how can we educate them and bring them into the fold with very little understanding of the culture here? So, how do you help, like you said, like, how do we get more older Somali women who have, 20, 30-year-old children? How do we get them to be advocates rather than like the app?
We actually do education. We do trainings every other Tuesday. I can send you the Zoom. Uh,
Oh, I love it.
yeah, and you guys, anybody here is welcome. I can send you the Zoom link. Is 6 to 8 p.m. I don't know if you guys if that time will work for you guys. It's
Yeah.
6 p.m. to our Minnesota time, and so we do talk about these things. In fact, we have moms whose sons and daughters went through the program, and now are giving back.
Oh, this makes me so happy.
Yeah, and so
Please.
it is the we have a lot of programs. Is one of the best things we have done. Like Mamuika, we show them how to use Narcan. We tell them about the brain
What is
chemistry.
Narcan?
So Narcan is so when someone is experiencing an overdose, what when you take too many. too much opioids, you stop breathing, you have a hard time, respiratory issues. So a Narcan is a medication that basically reverses the overdose. It's kind of like a miracle. There's the one that you could put. There's two kinds. There's the one that you can inject on a person. There's with needles and stuff. You can inject on the person's maybe like butt or some sort of a muscle. Or there's the ones that you could put on your nose, so you could. It's like a little spray, so you could.
Like and you'll start your
Yep, the person will come
absolutely.
back. Will come back. Yeah. So sometimes you might have to use two or three or four. What is really cool is we have trained a lot of the moms. We've given away a lot of Narcans, and some of the moms did use Narcan and saved their kids, and now they're in treatment and getting the help they need. So it's
Oh,
just
that's amazing.
yeah.
And finally, like, I want to hear something positive. There's change happening in our community again. Like, yes, we do have a problem and so forth, but it's people like you, Yusuf, and I'm sure there's people, so many young men who have graduated from your program and
Yeah.
rehab facility. So, yeah, tell me a success story, life after treatment center.
Yeah, we have I don't keep track of the numbers, but we have quite a few people that have graduated that are sober, that are going to school. Some of them are getting married. They're in a youth now. They're getting married. They work. They've been sober 2 3 years. And that's what makes the job fun. It really
Makes
like
me so
I'm
happy.
proud of that. And so we have a lot of guys that are making recovery fun. We have alumni program here, so all the guys that graduated, they come here once a month. We have pizza and we just talk about what is working for them, and a lot of them really do well after treatment. So we have a family here. We created a family here, and in fact I can invite a couple of those guys to come and speak and share their story, and kind of share their
We
story.
will be having them as a guest to tell us next time about, how this the story of struggle and how they've recovered and what life is like now. So I'm really, really looking forward to hearing that.
No, I think the story is very powerful, and even with that, there's a lot of shame and at first, but now like people are just kind of talking about it. So it's really important that we need again. For them, it was hard for them to speak, but now like wallahi, we have two or three or four guys that are coming up and saying, okay, I want to speak about my story. I don't want I want to share my story. So I think it's really important for people to come up and kind of own up, and own, that's nobody can take that away from them. That's their life. That's who they are.
Yeah, yeah. And then finally, also, I want you to speak of just that rehab. They say like relapse is quite common in the
Yes,
so it doesn't mean that they've failed. It just means it's part of the journey for them to
yes,
getting better.
yes. That is true. I genuinely believe in that. Sometimes people, you have to fall down a couple times before you start walking. We all, had, it takes a little while sometimes to learn how to walk. So you got to crawl before you walk, and sometimes you might stumble, and that's okay. But you got to just get back up and learn from your mistakes and move on. So yeah, we have had people who relapse, but then we just work with them and figure out. And alhamdulillah, it works great most of the time.
I have learned, me myself, after doing weeks of research, I've learned so much. Thank you so much, Yusuf. Really appreciate it, especially for what you're doing for the community. You being the first person of treatment center and so forth. So,
I think a couple of people that were asking questions.
oh, it says, how long after recovery do you stay in contact? What have you had been cases of relapse? So I think asking
Yeah.
about the relapse percentage, and also like how long after treatment center do you stay in contact?
I mean, every other week we talk to them quite a bit, and reach out to them. And yet sometimes people do relapse, and we just kind of learn and create some sort of a relapse prevention plan. And so after that, um, after they relapse, we're gonna figure out what happened, why it happened, how can we prevent it, and then we learn from that.
Yeah, thank you. I have another question from Chama. Do you do a psych evaluation for persons dealing with drug addiction?
Yes,
I
we
think
do.
that's part of your intake, right?
Yes, we do. We have a mental health therapist as well. So we do not only we don't only treat addiction, we treat mental health as
Mental
well.
health.
So we do diagnostic assessments, we do individual therapy, so that really helps a lot of guys.
Questions. Is there anything that you normally get asked that you can cover additionally to add to this?
I think someone asked the question of earlier about is the treatment center government funded or private? We
Yeah.
are licensed through the state, but we are private, so it's a private company. So, and I'm the owner. So we don't we just bill through insurance, and the insurance kind of pays for
The insurance covers it. Yeah.
treatment.
Every country is a little bit different.
Yeah, yeah.
But
We
yeah,
just have the universal healthcare system. But we here
yeah.
they have
I
it.
think in Canada we have Canada most there's like 50-50. We have like government funded, but there is a wait list, anything up to about 6 weeks or something like that. And also there's the private ones which are you have to pay money, and it's quite fancy. I'm not quite sure. The UK also has a system, but yeah, again there's private and government funded.
Sure.
Do you while they're do they go to AA or anything like that?
Yeah, we tried the AA thing, and honestly, AA is for Adam people. The way it's structured, and if I'm being quite honest, is designed for Adam people. So it didn't work for us. There is a group in New York that started Muslim-based AA. So we're just trying to kind of duplicate that and see if that works for us. But
Like a 12-step
yeah,
recovery, but like in more culture focused.
yeah, more like Muslim-based, more cultural, based. We'll try to do that. I think Dekha is asking a question, but I'm not sure. She said, "What advice do you give the kids?" Please.
Oh, actually, I have. Do you have any? There is some studies done, so saying that I wouldn't say we Somalis, but there are some studies that have been done that some ethnic groups are more susceptible to addiction, for example, like the Native community, to give you an example, because generationally, their forefathers have not been drinking alcohol, whatever. Once they were introduced to alcohol, they have much higher rates of getting addicted. So I've noticed, like, I barely know anybody that, casually drinks within the Somali community. Everybody either does it excessively or none at all.
Yes.
So can you speak about that a little bit?
Yeah, I don't think we, as far as Minnesota goes, maybe other places, but I haven't, that's a very good question. I haven't seen any studies that kind of shows
No, there
that.
isn't. Yeah.
As far as I know, if you do know, please share it with me. I'm curious to know as well, and learn from you guys. But I don't think we have that in Minnesota. In fact, we don't even have numbers of overdoses in Minnesota. I mean, because when the way the state looks at it, when they do these numbers, they just put under black, and then there's no section for Somali. And
Yeah,
obviously,
they don't take into consideration the cultural aspect.
yeah, and they don't have money for it.
Is
So
there any Muslim focused recovery program? Is there anything like that?
no, there's an AA group in New York, but the treatment centers we're at, there's a couple other ones in Minnesota that are Somali based or Somali owned or Muslim based, but not necessarily. I think someone was asking about the Islamic teaching regarding drug abuse and alcohol use part of the recovery treatment. That's a good question. For every client is different, so we have to meet everybody where they're at. Sometimes, I mean, I hate to say this, but a lot of these kids were traumatized in Dixie at times. So we have to be careful with with the religion piece. And if some client requests, we have a sheikh.
And Duksi, just to translate, Duksi means Islamic school, Quran school, like, for example. Yeah.
Yeah, it's like going to Catholic school in a sense.
Yeah.
And so we have an imam that comes once in a while, young guy, cool. He's really important for him to teach, about Islam is about forgiveness and Allah is forgiven, and so he's a young guy, so he's not like one of these older, I think, imams, I guess. So I think that's important that we do that. And a lot of the guys ask a lot of important questions. So yeah, we do have that kind of part of the program, but we also it's not very heavy focus because we have to be careful. But if a client asks for like going to Jum'ah prayer and stuff, we do things like that. Friday prayers, we can do that, but not so much of like bringing imam and we doing the Quran and stuff in the treatment. That's not where we are.
So is it therapy is the main?
Yes, individual therapy, group therapy, medication. So it depends on the client.
Okay. Every client
Uh,
has a different way and how they do things.
yes, yes. I think Deqa asked this questions. This question, please give us the wisdom for your for
Please
the
give
young.
us wisdom for the young kids on the call. Like, so for example, we have we have 5-year-olds upwards. So which wisdom, would you have for the young ones?
I think my
Age
mom
from
always.
5 to 15.
Uh, yeah, my mom always tells me you are who your friends are, right? So
Mm,
be careful with who you hang around with, the crowd that you in, the environment. The one advice I think one of my most important advice is okay to be you. Like it's okay to you don't have to be cool kid in the class. You could just be you. Sometimes your friends might be doing something that you might not like, and um, I guess try to just build that confidence of just doing things your own way. You don't have to be don't be a follower. Is what I'm saying. Um, and sort of just be you, right? So sometimes all your friend might be doing this, and maybe you have a lot of homework. It's okay for you to say, I'm gonna go do my homework, and they might be like, oh, well, it's Friday night, you should come with us, blah blah blah. Maybe you could say, you know what, I'm gonna go do my homework tonight. So it's okay. You don't have to be popular. Sometimes it's okay to take a different route, and it's okay for you to say no.
wow, that's amazing. And I have a question for Dega as well. What are the three top? I know you have to go. I'm going to let you
No,
go soon. But
no,
what
that's
are
okay.
the top three reasons why kids start?
Why they start using drugs and alcohol? I think the most important thing, the biggest thing is peer pressure for a lot of folks, for a lot of young kids. I had that when I was 12 years old.
We all went through that.
Yeah, and I had the opportunity to actually smoke marijuana, and I was invited to smoke marijuana. And so, all these kids were sitting in a circle and they were smoking, and they were like, "Here, hit it, it's your time." And I kind of looked at it, and I'll be honest, I almost wanted to do it, but then I thought about one thing my mom told me. She said, once you try drugs or alcohol, you might like it, and you might like, like you might just be addicted.
You
And
might just,
that's one
yeah.
thing reminded me. And I say, I'm gonna pass. And all my friends was like, "Oh, you're this, you're that, you're weak, blah blah blah." But I just walked away and went home. So the next day, everybody
So,
talking about it.
so what you're saying is, remember your mom's advice. I really like it. Once you try it, remember that you might really like it and
Yep,
be destructive.
yep, exactly, exactly.
Wow,
So
that's
it's
powerful.
it's really important for you. Those are the advice I'll give you. Hang around with the right crowd, be friends, be honest with your parents, ask questions. Right? If you're struggling with something, that's okay. Just ask. If you're struggling with depression, anxiety, don't be ashamed of it. This help.
Don't
This
be ashamed to talk about mental health. If you're
exactly.
sad, if you're down,
Yeah.
like it's
If you,
okay.
yeah, if you have anxiety, if you have ADHD, all that, those things are common. So there's medication, there's therapy, there's things that can help you.
Yeah. Um, there's an epidemic of loneliness going on right now. And what I mean by that is obviously there's the corona and so forth, but I've also read that, a big part of numbing the pain of addiction is people are feeling lonely. How can you speak about that a little bit?
If you say that again, the last part.
Basically loneliness, kids are like, this feeling of you might be in a room of with people but like or have siblings but like this feeling of like loneliness or you're the only person or whatever the case might be like.
Yeah, I think a lot. I mean, with technology, I have nieces and nephews, or I have family or friends, kids. Everybody's in their room with their smartphones. Nobody's even talking to each other. So it's okay for you to like. You gotta learn how to socialize. You gotta learn how to be up there with people. You gotta learn how to get out of your comfort zone. Right. That's one of the things advice I would give you to get out of your comfort zone. If you're a shy person, go make friends. If you're afraid of talking in front of other people, get on the stage and start talking to people. You gotta make yourself uncomfortable to be successful. I'll promise you that. You cannot just be in your own little box, right? And so if you're not in your own little box, you will never. If you don't challenge yourself, it's not gonna go anywhere. You can come in and just do the same thing, And sometimes people, you can only do that for so long. So get out of your comfort zone. Ask questions, ask for help. Talk to your parents, talk to your teachers, have a mentor. All those things are important.
I think we've pretty much covered it all. But we will be having you here again, Yusuf. So this is not the end for us. You will be giving us a little bit more advice. I think I have. We
Yeah,
need people like you. We need information. So we're going to put this video out there as well. I really, really appreciate all that you're doing for our community.
awesome. Thank you. And you could, people could reach out to me, give them my number or my Instagram.
I'll be putting your contact information and also about Alliance Wellness Center in Minnesota. I hope one day that we have things like that in Canada and also many other countries in the world.
I would love that. I've never been to Canada before, so I might come visit you guys if you do something.
You're welcome. Toronto is going to welcome you with a red carpet.
Yes, I'm excited. Thank you.
All right. Thank you again, Yusuf.
You're welcome. Have a good one.
Bye.